Hello, this presentation will be done over sexual abuse support groups. This therapeutic group discussed today is for sexual abuse and rape survivors. What is sexual abuse? Sexual abuse in criminal law is any act of sexual contact that a person suffers, submits to, participates in, or performs as a result of force or violence, threats, fear, or deception, or without having legally consented to the act. Sexual assault statistics. According to statistics shared by the CDC, in the U.S., millions of people are impacted by sexual assault every year. Because survivors often feel scared, humiliated, or ashamed to disclose their assault to friends, family, or the authorities, many cases go unreported. Consequently, researchers believe the data understates the severity of the issue at hand. Victims may also remain silent because they believe no one will assist them, or they have been threatened with worse damage if they disclose the situation to others. In 2020, the Sexual Assault Victims Advocacy Center released the following statistics. Every 73 seconds, another American is sexually assaulted. On average, there are 433,648 victims, ages 12 or older, of rape and sexual assault each year in the United States. 1 out of every 6 American women has been the victim of an attempted or completed rape in her lifetime. 1 out of every 10 rape victims are male. About 3% of men, or 1 in 33, have experienced an attempted or completed rape in their lifetime. American Indians are twice as likely to experience rape or sexual assault compared to all other races. 1 in 9 girls and 1 in 53 boys under the age of 18 experience sexual abuse or assault at the hands of an adult. Presenting problems. Post-traumatic stress disorder, depression, suicidal ideation, alcoholism, and eating disorders are linked to childhood sexual abuse. According to Yon, in addition to decreased sexual desire and relationship problems, survivors may also resort to extreme coping mechanisms and high-risk sexual activities. These authors share that in extreme situations, females could exhibit signs of a personality disorder, such as borderline personality disorder, which is characterized by persistent patterns of instability and impulsivity. These authors also shared that sexual trauma experienced as an adult is linked to both immediate and long-term psychological effects. Shock, panic, worry, disorientation, and withdrawal are some of the short-term impacts. While some women sustain anguish for years, many survivors do see a lessening in symptoms within a few months. These authors also shared that long-term effects can include physical symptoms even in the absence of a medical illness, extreme obsessions with appearances, PTSD, depression, eating disorders, sexual dysfunction, alcohol, and illicit drug use, non-fatal suicidal conduct, as well as suicidal threats. Insight into mental health issues are associated with the intensity of assaults, other traumatic events in life, dysfunctional thought patterns, and feelings of helplessness. Presenting problems continued. Victims of sexual abuse may also experience feelings of shame and embarrassment, fear or experience of a negative response to disclosure, difficulty communicating sexual abuse, and substance addiction. Concerns that victims of sexual assault do display harmful behaviors are supported by study results reported in the Journal of Women's Health. Based on earlier studies, women who are chemically dependent do have a higher rate of history of sexual abuse. Treatment for chemically addicted women should include therapy for sexual abuse, as evidenced by the prevalence of sexual abuse discovered in their stories and the correlations between sexual abuse and the measures of severity of drug problems. Group counseling sexual assault victims study. Ideally, support groups would offer a venue for others who have experienced comparable trauma to connect, exchange stories, and offer mutual assistance to one another. In a preliminary investigation on the effects of compassion-focused group therapy on adult female sexual abuse survivors, promising results were found. In this study, adult female survivors of childhood sexual assault were used in the development of testing to see if there was any improvement in high levels of self-criticism and shame presented by the survivors. Positive participant evaluation, along with low attrition and high session attendance, indicated that the program was successful. From before to after the intervention, there was a noticeable improvement in every outcome measure. With medium to significant effect sizes, participants showed decreased feelings of shame, self-criticism, and post-traumatic stress disorder, as well as improved self-compassion and self-assurance. They also showed decreased worry related to depression, anxiety, and stress. Between 20 and 57% of participants showed consistent change from pre-intervention to post-intervention, and between 22 and 57% from pre-intervention to follow-up across all measures. Group session challenges. While group therapy may prove beneficial for some victims of sexual assault, there are disadvantages to be considered. These disadvantages include not being the main focus of the counselor, having less confidentiality, a less focused therapeutic alliance, less flexibility, the possibility of contention between group members, and more possible factors contributing to an improper therapeutic fit. Additional challenges may include factors such as conflict, patients consuming the group's time, lack of engagement, and patients' differing limits. While conflict within a group is natural, it is the responsibility of the group leaders to address these conflicts, ensure group members are staying on the topic and attentive during the sessions, while also being cognitive of group members' differing limits. Group leaders are subject to confidentiality rules pertaining to patients' medical histories, diagnosis, and other personal information. However, the other group members are not subject to the same restrictions and cannot be sued or held liable for disclosing material from sessions. Individual patient confidentiality can therefore be challenging to uphold, particularly in bigger groups when group leaders have less influence over what information is released. While having the ability to divulge private information can be beneficial to the therapeutic process, some patients may be reluctant to divulge certain details out of concern that someone else might repeat them. This can negatively impact the patient's mental health as they struggle to make a contribution while upholding their confidentiality. Providers can lessen this tension, though, if they create a set of confidentiality or sharing standards that the group approves of and go over the boundaries of secrecy with members prior to the first session or as needed through sessions given. The population of this group will be women 18 and up. They will meet the first and third Tuesday of each month from 5:30 to 7. The goals are to increase members' knowledge of trauma, to create a safe community and support for its members, for members to freely express themselves, and to mitigate trauma responses and identify triggers. In the first session, we will begin by introducing the goals and the nature of the group, which is to provide a safe space to heal from trauma, develop coping strategies, rebuild self-esteem, and make informed decisions about their futures. This session will contain a psychoeducational presentation on the way in which the body stores and processes trauma. Each member will receive an educational pamphlet on the brain's chemical reactions and stored trauma's impact on the body. The engagement activity will be that members are given time to share their experience with trauma or trauma's physiological or psychological impact on them. Members will be encouraged to freely share their stories, including their feelings, moods, and behaviors. In the second section, we will begin by exploring the benefits of releasing inner feelings of trauma and finding a safe place to do so. Members will have a chance to participate in art therapy and conceptualize their emotions by establishing a visual presentation of a safe space through their art. Members will be given the chance to share their art and expression if they so choose. Members will then be encouraged to begin similar practices outside of group sessions, such as journaling. The engagement activity will be to begin trying to implement the psychoeducational information from the previous week's session. Members will partake in role-playing activities where they are given the opportunity to regulate their emotions and physical reaction to these emotions. In the third session, this session will be focused on implementing cognitive behavioral therapy strategies and reframing unhealthy and negative thoughts by group members. Members will be given the opportunity to share negative thoughts they have of themselves as a result of their abuse. The engagement activity is that each member will be passed a sheet of paper to write their name on. Then, the paper will be passed around the group for each member to write a positive affirmation directed to that member. This exercise will provide a positive outlook for group members, and it can uplift group members and remind them of the reality of their worth. By the end of these sessions, the goal is for group members to establish a sense of community, reframe the way they see themselves and their world, and have tools necessary to live a healthy lifestyle. Previous research has shown that cognitive behavioral group therapy is an effective treatment for depression. A study looked into patient records who were identified as having received the treatment, and 88 patients of 143 were included in this outcome. The score was the main outcome measure, and these authors found that the average score decreased from 28.5 to 18.5. Steps moving forward. When considering a time frame for session count or group therapy, Riva and Hobb suggest that brief groups, as few as 6 sessions, can be effective in reducing psychological issues. Moving forward, group members should pursue individual counseling or search for other topic-related support groups. The role of the counselor. Because sexual abuse results in both psychological and physiological trauma, counselors must take integrative and holistic approaches to treatment. Survivors of sexual abuse may benefit from both personal counseling and group counseling sessions. Counselors must be willing to collaborate with other mental health professionals for the best possible outcome of their clients. While individual therapy may be beneficial for working through specific memories or negative thought processes pertaining to trauma, group counseling offers a unique benefit to victims. It provides a sense of community, allowing other members of the group to share their differing perspectives, healing techniques, and provide accountability along the way. Women and minority groups experience a higher burden of sexual violence. For example, more than 2 in 5 non-Hispanic American Indian or Alaskan Native and non-Hispanic multicultural women were raped in their lifetime. This shows the ever-growing need for counselors to ensure they have proper competency and diversity training. Part of the process of becoming an effective counselor involves learning how to recognize diversity issues and shaping one's counseling practice to fit the client's worldview. It is an ethical obligation for counselors to develop sensitivity to cultural differences if they hope to make interventions that are consistent with the values of their clients. The therapist's role is to assist clients in making decisions that are congruent with their worldview, not to live by the therapist's values. And then this presentation is concluded with a list of references and photos used. Thank you so much for watching this report on sexual abuse as it relates to support groups. This is a matter very close to my heart, and it has been a privilege to put together this presentation. Thank you so much, and God bless.